I take this opportunity to thank the government of Japan for the consistent support that it has provided over the years to KEMRI. JICA support has been a major contributor to the infrastructural and scientific growth of this institution, as well as the deepening of ties between the two countries. I, at this point, have the pleasure, before I turn to the COVID statistics, I have the pleasure to request His Excellency the Japanese Ambassador to Kenya, Roichi Hoire, to come over to the podium and address us. But before he addresses us, I want to say why we're here at this institution with our Japanese partners today. It's because we are also going to be witnessing a donation of some 500 COVID-19 test kits that will enable us to conduct 50,000 COVID-19 tests. And once again, we want to say a big thank you to the government of Japan for this donation, which actually comes at a very good time, considering that the instability we have been experiencing in the supply chain system for testing. Your Excellency, welcome.
The Chief Administrative Secretary for Health, Dr. Rashid Aman, Director General KEMRI, Professor Yerekombe, distinguished guests and ladies and gentlemen, Hamjambo Nyote. First, I'd like to express my deepest appreciation and gratitude to all health workers of Kenya who have made greatest efforts and sacrifices in our war against this deadly coronavirus. Asanteni sana. Ladies and gentlemen, it is my great honor to have this opportunity to address speech here in the Kenyan Medical Research Institute, KEMRI, which Japan supported its establishment in 1979. Since then, KEMRI has been the center of medical research, not only in Kenya, but also in whole Africa. Japan has developed very cordial relationship with KEMRI for nearly 40 years. And today, I'm again honored to announce Japan donates PCR test kits with capacity of 50,000 tests through the Japan International Cooperation Agency, JICA, which is a governmental implementation agency for ODA. So this is one of Japan's seamless cooperation to Kenya. Ladies and gentlemen, since the beginning of COVID-19 pandemic in Kenya, Japan has been contributing to the fight against the virus in this country, such as JICA supply of chlorine to water purification facilities. Japan has also disbursed to Kenya around 340 million Kenya shillings through UNDP and the UNICEF to strengthen the health system and provide medical equipment such as medical masks and goggles to hospitals. Furthermore, this morning, I have signed exchange of note titled Health Sector Policy Loan for Attainment of the Universal Health Coverage with Honorable Yatani of Treasury at his office. The total amount is more than 8 billion Kenya shilling. We have done first phase of this same assistance in the past amounting to 4 billion. So putting together total 12 million Kenya shilling assistance for the health sector of this country. At the occasion of signing this morning, I agreed with Mr. Yatani to sign another exchange of note next week Friday to disperse Japanese grant aid for provision of medical equipment to over 10 counties in Kenya. In addition to that, Japan will provide 10 ambulances to Kenya through the counterpart fund. We expect that these assistances will be utilized effectively by the Kenyan government and all the agencies to help fight against COVID-19. Ladies and gentlemen, I assure you all Kenyans, Japan will be continuously and endlessly committed to Kenya, not only in the area of economic development, but also for fighting against this pandemic. I'm looking forward to seeing you all very soon at the occasion of our contribution to Kenya in near future. Sisi Wajapani tuko pamoja na wananchi wa Kenya. Asanteni sana.
Asante sana, Your Excellency, and once again, on behalf of the government, we want to appreciate the level of friendship, the depth of friendship that we enjoy with the government of Japan, and the support that you are providing, not only for COVID-19, but also to other sectors of the economy. Thank you. We will now move to the report on the COVID statistics for the day. Today, 373 people have tested positive following testing of 4,663 samples over the last 24 hours, bringing the total number of confirmed cases in the country to 33,389. Our cumulative tests now stand at 438,193. From the cases being reported today, all are Kenyans except 13 that are foreigners. 273 of these 373 are males, 100 are females. The youngest is 1-month-old infant, and the oldest is 80 years. The distribution of cases by counties is as follows. Nairobi, as is usual, leads with 117, Busia with 66, Nakuru with 37, Kisii with 32, Homa Bay with 15, Kiambu 12, Kisumu 11, Uasin Gishu 8, Garissa 7, Isiolo 7, Narok 7, Taita Taveta 7, Mombasa 6, Muranga 5, Migori 5, Kajiado 4, Kirinyaga 4, Kericho 3, Nandi 3, Nyeri 3, Machakos 3, Bomet 2, Kakamega 2, Kitui 2, Nyamira 1, Siaya 1, Turkana 1, Meru 1, and Makueni 1. We will deep dive into the 117 cases in Nairobi and identify that they came from Roysambu, 18, Langata 12, Westlands 10, Embakasi Central 9, Dagoretti North 8, Kamkunji 7, Embakasi West, Kibra and Makadara 6 each, Dagoretti South, Mathare and Starehe 5 each, and Embakasi East, Embakasi North, Embakasi South, Kasarani, and Ruaraka have 4 cases each. The second county with the highest numbers is Busia with 66 cases coming largely from Matayos, 62, Teso North 4, and in Nakuru, the 37 cases are from Naivasha, 15, Nakuru East 10, Rongai 5, Kuresoi North and Nakuru West, 2 cases each, while Gilgil, Molo, and Njoro have 1 case each. The rest of the breakdown for the counties is in the document as you will receive it. Today, we are pleased to announce that 72 patients have recovered from the disease. 36 of these are from the home-based care program, and the other 36 have been discharged from various hospitals where they were receiving care. Our total number of recoveries is now 19,368. Sadly also, we have lost 3 patients to the disease, bringing our fatality cases to 567. We want to both thank the healthcare workers in the front line who are working tirelessly in this response in saving lives, and we also want to send our sincere condolences to the families and friends of those who have lost their loved ones to this disease, not only over the last 24 hours, but during the course of this pandemic, and we wish well for them. I thank you. I think from here I will entertain, as usual, questions, and I'm hoping that the questions will be directed to me on COVID-19, and no questions will be directed to His Excellency, the Ambassador. After we have completed the question and answer session, we shall then move over to receive the donation that we are being provided with today. Thank you.
Thank you for the opportunity. Good afternoon, Your Excellency. Good afternoon, Dr. CAS. My 2 questions will be directed to you as per instructions. The first one is, we have our community health volunteers who are part of the healthcare sector and also indeed part of the frontline health workers who are dealing with this pandemic at grassroots level. Would you be kind enough to give us details on whether their stipend, which has been promised for a while, will finally be availed to them? Secondly, wanted to find out if we have enough supply of oxygen in our facilities to help those patients who will require to be put on a respirator in case they are admitted with COVID-19 infection. Thank you. So sorry for that lack of temporary lapse in protocol. My name is Agri Omboki from the Daily Nation newspaper.
My name is Graham Kajilo from The Standard. My question will go to the ministry. I remember the other time you said you will provide the list of, or a database of the PPEs that have been distributed to counties and also probably the hospitals. So I'm just reminding you on that. But the second question is about testing. We are already not testing to our capacity, and we have issues with the backlogs and also with the reagents and testing kits. We have seen the World Health Organization has already said that Africa is already almost past, or probably past its own peak. So I'd like to find out these challenges that we get in testing and reagents and backlogs, has it affected our peak? Have we missed our own peak? Or if we haven't missed, to mean that we are still in line with the modeling that late August and early September, we expect the peak. So should we expect another peak after the flattening of this curve?
Nancy Okware kutoka KBC. Swali langu la kwanza ni kwa Wizara ya Afya, hususan kuhusiana na wale wagonjwa ambao wanapokea matibabu pale nyumbani. Kama wizara unapoangalia katika kaunti, ni kaunti zipi ambazo zinafanya vyema zaidi katika kuhakikisha kwamba wale wagonjwa wanatoka hospitalini baada ya kupokea yale matibabu ama pale nyumbani, na vile vile zile kaunti ambazo zimekuwa zikitoa idadi ndogo ya wagonjwa, changamoto kuu pengine ni ipi? Ni ukosefu wa wale wafanyikazi wa kutosha, wale wa jamii. Na mwisho kabisa, manake leo hii tuko hapa KEMRI, swali langu ningependa kuuliza uongozi wa KEMRI. Wakenya wanauliza mmefikia wapi katika utafiti ama zile juhudi za kuhakikisha kwamba tunapata chanjo ya virusi vya corona, na je, kuna ule uwezekano kwamba vile vile mnaangazia kutafuta pengine dawa ya kienyeji? Shukran.
Jina langu ni Nancy Mweu kutoka Milele FM. Swali langu ni kuhusiana na vifaa vilivyonunuliwa. Asubuhi ya leo tumeweza kusikia KEMSA ikiweza kusema vifaa hivyo vilivyogharimu shilingi bilioni 6.2 bado havijapata mnunuzi. Hatujui hali itakuwa vipi, vitapunguzwa bei ama kama wizara mtafanya vipi. Swali langu la pili ni kuhusiana na mliweza kuzungumza majuma mawili yaliyopita kuhusu vifaa vya kupima mkisema kwamba viko karibu kufika. Sijui kama tayari vimeweza kuwasili Wakenya wataanza kushuhudia ule upimaji wa halaiki. Asante.
Okay. Thank you very much. Indeed, yes, community health volunteers are really a key segment of our primary health care approach, including the universal health care program that we are running, and now also in the COVID-19 pandemic. They are right there at the forefront, interacting with the communities and providing the services required there. The community health volunteers, health being devolved, is responsibility of the county governments. It is the county governments that hire them and, where necessary, agreed upon stipends provided to them. And I believe that the fact that we still have them on service, providing that service, that perhaps by and large most of the counties are doing something to provide them with these stipends. There may be some exceptions here and there where stipends may have been delayed, equally in the same sense that we have seen some salaries being delayed because of the stagnation of the revenue sharing formula that is under process, and we expect that once that is cleared up and resources flow to the counties, we should be able to ensure that all the healthcare workers get their dues. But I will also ask the DG if he has further information on that to respond to that as well. Regarding the supply of oxygen, in fact, that is one of the key elements that we are looking at very carefully in our response, because even as we build capacity and we increase the preparedness of our facilities in the counties to be able to respond, to provide the required clinical management of COVID-19 cases, we understand that because of the nature of the disease and the course of the disease, is critical. It's not just enough to have ICU facilities and ventilators and other gadgets when you don't have the key ingredient required, which is the oxygen. It's an area that we have been looking at very carefully. Part of the assessment concerns assessing what facilities have oxygen, what needs centralized oxygen, which ones need support. So this one is an area that is actively being looked at, and we have information on the level of availability of oxygen, either in cylinders or centrally available, as well as the actions that we would like to put in place to make sure that these facilities are available in those facilities that are being set up to cope with this COVID pandemic. Graham Kajilu Standard, indeed, I did ask our team if we could get a list of the PPEs, a database of PPEs distributed. I think, again, maybe the DG might be able to respond to that more appropriately. In terms of testing, as I said yesterday and the day before, when asked about our lower number of tests that we are now carrying out, as we have said on various occasions before, that testing remains a challenge not only for a country like Kenya, but also in the developed countries. It remains a challenge because of the high demand for the commodities required for testing, the limited availability of these, which by the day is improving, but we have been able to maintain a certain level of testing. I mentioned yesterday that we were expecting a consignment for our high throughput automated testing system that was supposed to come in earlier in this month. We have had challenges receiving that, but we expect that we should be able to receive that consignment and ramp up our testing as soon as we receive that. And I must say that even today's contribution is a big contribution in that direction, because with 50,000 tests, we should be able to do quite a lot. So I think as far as testing is concerned, we should be able to get over these hurdles very quickly and continue with the level of testing that we had intended to do before. Then the issue of the flattening of the peak in Africa. I did read something on the WHO regional office talking about the general trend in Africa. It is true that there is that general trend where the positivity rate seems to have been coming down, but we must treat this with caution. And the reason why the World Health Organization stipulates that you must maintain a level of 5% positivity for at least 2 weeks is because you need time to be sure that this flattening is real. It is real because of the actions that are being taken, and that it is not something that is created by some problems or bottlenecks in our testing system, in our sampling system, and so on. So we will have to continue to observe the trend of this positivity rate, but I think the indications are a little promising when we see several of the countries experiencing more or less the same trend. Again, I want to say very clearly that this is not time for us to relax and say our peak has flattened and we relax the measures that we have put in place. In fact, if anything, we must heighten these measures, because if indeed it's happening, it's because of the measures that we have put in place and the observance of these measures that have resulted in this. So let us not celebrate, let us not be complacent, let us not relent. We need to continue observing what we have observed until we are able to establish for sure where we are as far as this peak is concerned. And whether we get another peak. Of course, we will get another peak if we change things. If we stop doing the things we are doing, we are certainly going to get another peak, and we don't know how high that peak will be. We have seen countries where they have had multiple peaks. So we are likely to see that, and that is why the message that we should not relent, we should continue doing what we are doing, is the best one for us to ensure that when we flatten that, we start moving down that slope. KBC, mliuliza kaunti gani ambapo inafanya vizuri kwa upande wa home-based care na kaunti gani zina mashida katika hiyo program. Hayo nafikiri nitamwachia DG akajibu. The vaccine. We have said before that, and we know that there has been an accelerated effort globally to try to develop a vaccine against this disease. Some of these vaccines, a handful of them, have progressed very far. Some are actually being used. As you know, the Russian vaccine has already been deployed for use. Others are in the final phase 3 trials before they become authorized for use. So very soon we think that there will be a number of candidates that will be available for use once they have been licensed. And we must also, as a country, position ourselves to be able to be at a point where we can be able to access these vaccines when they become available. As far as the developing countries are concerned, this is being addressed through discussions with the Global Vaccine Initiative, or Gavi, and some arrangements are being worked out on how these countries would be able to access these vaccines. We are also involved as a country in one of the vaccine trials, the Oxford vaccine, with one of our institutions, KEMRI, and so we want to be part of this. When these vaccines become available, we don't want to be left out or be at the end of a queue, and we are doing what we can to begin discussions and arrangements with various parties to see that we can benefit from these vaccines when they become available. Traditional medicine, You were not with us, but we walked around here and we were shown the traditional medicine department here that is doing exactly that and exploring traditional herbs and plants, some which they have already, KEMRI has already demonstrated are active against other viruses, like the herpes virus. They are re-exploring that to see whether it has any action against coronavirus. And they have also other traditional preparations that are being looked at right here at this institution to determine their efficacy against the coronavirus. Milele, the commodities at KEMSA, whether they will, whether we shall reduce the cost or what do we do with them. I think, you know, we're in this COVID-19 pandemic for a while. It is not something that is going to go away for a while. We are going to have a need for these PPEs and all of these commodities for some time to come. And I'm certain that those commodities which we are holding in KEMSA should be available to support this response. As to the cost and issue, I think that is something else that will have to be looked at separately at a different time. In terms of testing, I think I have responded to the testing issue. So we feel we are not at a very bad place as far as testing is concerned. So I want to thank you because I think I have responded to the questions that have been posed to me, but I want the DG to have an opportunity maybe to expound on some of the responses that I provided.
Thank you, CS. Thank you, Your Excellency, Ambassador of Japan. I'll start by Graham's question during the WHO Regional Committee meeting that was held in virtually but centered in Brazzaville on Tuesday, in which we participated. Yes, Africa generally is making good progress. And if you look at the trends in terms of the epic curves, quite a number of African countries have already hit their peak. And Kenya is no exception. We are within that peak. But this is not a time to loosen the measures that we have put in place. And that is what informed the advisory that we gave His Excellency yesterday, that formed part of his address to the nation yesterday, that we are making progress, but we need to maintain these measures so that we can see us hitting the magical 5% positivity rate. And we believe, and my appeal to Kenyans is that it has been a long walk, but we are seeing the light at the end of the tunnel. Let's hold hands together, and eventually we shall prevail. So let's not relax on the measures that we have put in place. We are making significant progress, like other African countries and the rest of the world. And for sure, if we continue in that traction, then very soon we shall flatten our curve. The second wave was responded very well to that. You can have a second and even a third wave. More deadlier, like now South Korea is experiencing a second wave, which is just isolated in the capital city and is hitting more of the elderly. As we have told you before, the evolution of this pandemic will vary from place to place because various counties are at different phases of the pandemic. You know, we have counties which have reported very, very few cases where we can still do 100% contact tracing and we can be able to actually vanquish the pattern of transmission. While in others we have established community transmission where it gets more difficult by the day to be able to do contact tracing. So the interventions that we have designed will vary from county to county, and in our discussions with the county government health department teams, we shall continue to update them on the measures that they need to be able to put in place so that as a country we move in unison. The question about the community health volunteers, yes, these are a critical component of the health workforce, and so far we have sensitized more than 90,000 community health volunteers who are working in various counties to be able to support us. And this is why you have seen quite a number of cases of our cases now being managed at home through the support of the community health volunteers and other frontline healthcare workers. As a result of that, more than 60% of our discharges to date or our recoveries are from home-based care. And you can also be able to extrapolate that to see the magnitude of saving that the country has made taking into consideration that even if you are to take care of an asymptomatic case in an institutional facility, you'll spend more than 21,000 shillings per day, basically because of the cost of the PPEs. So we'll continue to work with the counties to ensure that we strengthen the community health services systems, especially that this is a platform that we are going to use beyond the COVID-19 pandemic. Remember, when we want to scale up universal health coverage, our approach towards UHC is through preventive and promotive health care. And this is services that will be offered at the community level, level 1, the dispensaries, and level 3, the health centers. So this is where we are going to put a lot of emphasis. Studies have shown that investment in preventive health care yields more dividend compared to our previous investment in curative health services, which is usually more expensive and less efficient. So we will continue to support the community health volunteers, dialogue with the counties to ensure that they get their stipends, ensure that they get enrolled into the NHIF program, and also support them to be able to develop other income-generating activities so that they are motivated to come and support the members of the community. In terms of the oxygen supply for COVID-19, again, remember 93% of our patients are asymptomatic. So as we go forward, as the cases decrease, fewer and fewer patients are getting into the hospital, fewer and fewer patients are getting for critical care. But that notwithstanding, this is a facility that will still need to be able to use beyond the COVID-19. As at last week, the county governments had put an additional 7,500 isolation beds in line with what was discussed in the 9th and 10th extraordinary summit between His Excellency the President and the governors. We also have an additional 350 ICU facilities with fully piped oxygen. So this is still work in progress, and we should not simply tie it down to the COVID pandemic, but look at it as additional capacity that we shall be able to use in our aspiration to achieve UHC by 2022. And of course, the other thing that we'll need to do with this additional capacity is medical tourism. We are going to have such a huge redundant capacity at the county level that we now need to see how we can be able to change our medical tourism policy to be able to get people from Tanzania, from South Sudan, Somali, DRC, Congo, Rwanda, Burundi, Uganda, to come for healthcare services. And in our thinking, we are trying to see how we can be able to cluster the counties so that they can be able to offer specialized services. Say a cluster of 5-6 counties can specialize in renal services, another 4-5 can be able to specialize in cardiac services. That way we'll not only build our capacity further, but we'll also be able to bring down the cost of healthcare as more people come to seek for services. There was the question of testing, which I think Waziri has responded to. So, Graham, we have not missed our peak. Everything is still falling into place vis-a-vis what we told you at the beginning of the pandemic. You remember we told you early in April that we'll hit our peak in August, September. And if you look at our figures, that is falling into place. We told you that quite a number of our cases will be asymptomatic. That was initially 70-80%, now it's 93%. We even mapped out the counties which we thought are going to be hotspots. And essentially the pandemic has panned out exactly in that framework without any big difference. So we still stand by our modeling projections, but our team from Jomo Kenyatta University and also Nairobi University and our colleagues from KEMRI. I think that is all that came my way. Thank you. There was something about PPEs, and we are glad today the chair of the boss of the distribution of the PPEs and other donations is here. Let him carry his own cross.
I think the question we have continuously told you is actually not a question of only PP. It goes beyond PP because there are other commodities which are there. There are other supportive instruments which have been donated. Is the list there? Yes, it is there. And in particular, it is also accompanied with the expression of interest. For example, we are with JICA today. JICA, before they did the donation, they did an expression of interest. They are donating a number X of items, X, Y, Z. So that we have.
Okay. Can I say a few words? Yes, Your Excellency.
I'm not expected to entertain a question at the moment, but if you have any question or inquiries, please contact to my embassy. And today we have already circulated press release about this morning signing ceremony of 80 billion shilling cooperation, and these occasions, the details. Asante sana.
Thank you, Your Excellency. I think now we can move forward to the ceremony of receiving the donation. I don't know, DG will direct us where this has been set up. Thank you.
You know.